Is strategy consultant Dikbo Oyewole. He will be reacting to this development. Dikbo, good morning. Thank you for joining us on TVC Breakfast.
Good morning, Veronica.
Now, the government is saying it is taking this proactive step to ensure that, looking at what is happening in India, taking into cognizance what is happening in India, and also because of the state of our health system in its fragile state, and also the vaccine delay, as well as the non-compliance to the safety protocols. From your point of view, is this step proactive enough to addressing what we see in India, ensuring that it doesn't become our own situation?
Well, proactive, I believe it is, but is it going to be effective? Remember that we had our first lockdown and it was almost squandered because we didn't really do a lot of testing and we didn't maximize that time. So the question is, do they have an adequate game plan? Do they have clear strategies as to how to maximize this next restriction? Some people say it's a lockdown, some people say it's a restriction, but what are the strategies they have in place to ensure that they are maximized? I'm surprised that they kept saying, or they still included in saying, that to enter government buildings you require masks. I didn't think that was ever relaxed, okay? And it didn't sound like they were saying it for emphasis, meaning that a lot of people have gone to sleep thinking that all is well, thinking that there is no more COVID-19 out there. But I would like to see a clear plan as to how they intend to maximize this new restriction, because the economy is just trying to get itself back up. Businesses are just trying to come back alive. And now we're having to go back to where we were around this time last year. So I think it will be quite irresponsible if we don't have clear plans as to how to maximize this time and then ending up to wasting it like we wasted the first lockdown. Because we need to understand that things are quite challenging for a lot of people. Prices of food and other things has gone up drastically. So now you're saying that certain persons will maybe get to work less hours, which may mean less pay for them. And so we need to look at it holistically, the entire conversation around this new restriction and what it does mean for us as Nigerians.
So perhaps this is why they are asking that state governors should take leadership positions with this addressing COVID-19 across the states. Have we seen that over the past 1 year of we addressing this issue?
No, we haven't. And interestingly, you would remember that at the beginning of the lockdown and all of that, once it was eased the first time, the first set of people to break the restrictions were government officials, having massive weddings, burials, events, campaigns, and all of that. So I think it is quite humorous then saying that the governors should take the lead, because in Nigeria, the first people to break such restrictions are government officials, people that make that put up the restrictions, people that are supposed to be responsible for upholding the law, people that are supposed to set clear examples. And that was a challenge we had initially in Nigeria, because it was looking to the common man like, so these are the people that made the rule. They said you should social distance, but they're not doing that, so why should I? These people have a lot of money, they have a lot more to lose. They're not doing these things that they say will save lives, so why should I? I have less to lose. So that was the fundamental challenge that we had. But I think now is a good time to have everybody from top to whatever level in government to show adequate responsibility and take proper leadership with regards to especially setting example with this new restriction and seeing that things are done properly. It is time for us to get COVID-19 out of Nigeria. We had a little over 1 million people vaccinated. It's a drop in the bucket. We knew that the vaccines weren't going to be enough. We're hoping to have the new round come around very, very soon. And yes, a lot of Nigerians are open to being vaccinated. Also, a lot of people are not open to being vaccinated. So we would like to have the vaccines around for the people who are open to being vaccinated and who didn't get it the first time around. But yes, I believe that we do need to see a lot of leadership being played by not just the governors, but our leaders in every facet of our government.
Now, would you say then that we have learned lessons from the previous lockdown experiences that we have had?
I'm not sure what the clear lessons are or what they have been, because so the way we've been going about it is it's quite difficult for me to say that we've learned lessons, and that's why a lot of us are quite pessimistic about this new restriction or this new lockdown. That would it be effective? Would it not just be a waste of time? Would it just not be a waste of resources in terms of man hours and people not getting to earn a living because of, like I said, things are really expensive right now. Things are practically times 2, times 3 of what they are. Gari is now 1.5 a bucket. The crate of eggs is 1.5 a bucket, a crate, and all these other prices, everything has gone up. Okay, so the question is, how do you intend for people to survive? What are the alternatives? Are we going to have another round of palliatives? What duration do you have for this lockdown? Do you have any clear duration in mind? Are you saying 72 hours? Are you saying 2 weeks? Are you saying 1 month? Or we'll just go with the flow?
Well, the government is saying that June the 11th, it will look at reviewing the protocols or the measures put in place June the 11th from recent reports. Yes. Yeah.
So that's a month. So the question is, what's the plan to have people locked down for a month, going by the challenges we had with the last one? I remember some time ago we had this conversation on your platform where I stated that there were clear issues around the security with the first lockdown that happened, that it was very long, and then because a lot of people couldn't go out to earn a living, a lot of people were stranded, and then there were certain issues that came around where people were being targeted and seen as, okay, so it had now become a battle of the haves and have-nots.
We wouldn't necessarily call this a lockdown, because intrastate travel is still very much allowed. It's just that some businesses would be shut and movement restricted at a particular time of the day. So I wouldn't want us to make it seem like it's a lockdown. It's just a measure, like the government has put it, so that people watching us wouldn't confuse what the government is saying. But then if we are to provide leadership necessary, because as it is right now, so much is going on across countries, and government is saying that it's only about essential travel, that it will only encourage essential travel. And a lot of persons are saying, you know how it is, a lot of people are traveling out of the country, some are coming in. Some have said that perhaps we need to begin to put in measures to say that restrict travel to areas like India, Brazil, where we are seeing these strains that are seemingly virulent.
Yes. And I believe that the government, I believe there was a communique that was sent out a while ago where they had done that. And speaking about the restriction and the implications for Nigerians, yes, certain businesses will be affected, and certain livelihoods will be affected as well. So for me, I'm just very interested in the clear plan that the government has, saying that we do not waste this opportunity and saying that we maximize it. Whatever restrictions we have in place, let's see that people adhere to it and adhere to it very well. Let's have leadership shown from the side of the government, and let's get this thing done once and for all. The travel restrictions are very much welcome because, I mean, there's nothing fantastic about it at this time. A lot of nations are doing that, and they have been doing that to ensure that the folks within their borders, the citizens, are kept safe, and they stamp out COVID-19 from their own country. And so I believe that a nation like Nigeria, where we haven't had so many people vaccinated compared to our total population, we also need to pay extra care excuse me, to these issues around travel restrictions, and saying that we don't have new cases and new strains come into the country because we may not be able to handle it. So we don't have things escalate from where they are today.
All right, quickly, Dikpa, one question I would like for you to, one issue I'd like for you to address, which has to do with vaccines. You see that even in the government is talking about the delay in vaccines, and a lot of persons are saying perhaps Africa needs to sit down now and begin to look inward, perhaps not just Nigeria, but Africa as a continent, saying we need to stop waiting for things like this and develop something to address any other challenge that comes along health-wise.
I believe so, and we're a lot that we agree on that. We've had this conversation for a year now about having in-house vaccination in Africa and seeing what we're doing about it. I believe that a lot of scientists, a lot of labs are trying to get this done. Maybe they're a bit slower than our Western counterparts, but I believe that a lot of people, a lot of scientists, a lot of brilliant minds in the African continent are trying to get this done. Maybe they have constraints with the resources and what they need to get it done as quickly, maybe funding as well. They're having restrictions compared to the Western counterparts, but I believe that a lot of people are working on it. But I believe that we also need to see how we can invest, in Africa to see that these scientists, these laboratories get this done out there. It is enough that we're having to wait from the West to see that we have vaccines. We can have our own vaccines here in Africa, and it is time that we have it done.
Dipo Oyewole, strategy consultant, thank you for your time on the program.
Thank you for having me.